Paracetamol is a very common medicine. Many people around the world use it. It helps to relieve pain. It can also reduce a fever. The generic name for this drug is acetaminophen. This is important to know. It helps you identify the medicine. We will learn more about it today. You might know paracetamol by other names. These are called brand names. Panadol is a very well-known brand. Calpol is a common brand for children, often in syrup form. Tylenol is another popular choice in some countries. All these brands contain the same active ingredient. That active ingredient is paracetamol, or acetaminophen. So they work in a similar way to provide relief. Why is paracetamol so widely used by so many people? One reason is its availability in many places. You can often buy it without a doctor's prescription. This makes it easy to get when you need it quickly. It is effective for many common aches and pains. It also works well to bring down high temperatures. Many households keep it in their medicine cabinet. It is a go-to for simple health issues like mild pain. In this discussion, we will explore paracetamol further. We will look at how it provides relief from discomfort. We will discuss the correct ways to use it safely. Understanding dosages is very important for your health. We will also cover potential side effects you should know, and we will talk about important warnings and precautions. This knowledge helps you use it responsibly and wisely. Your health and safety are always the top priority. How exactly does paracetamol work in our bodies? The complete mechanism is not fully understood by scientists. However, we have some good ideas about its action. It is believed to work mainly in the central nervous system. This system includes your brain and your spinal cord. It seems to block the production of chemicals called prostaglandins. These chemicals are involved in signaling pain and causing fever. This action helps to reduce your discomfort and lower temperature. Paracetamol is used for many types of pain. Headaches are a very common reason people take it. This includes tension headaches, which many individuals experience. It can also provide relief from troublesome backache. Muscle aches and general body pains can often be eased. People frequently use it for the discomfort of toothaches as well. It helps manage mild to moderate pain effectively. It allows people to continue their daily activities more comfortably. Lowering fever is another key use of paracetamol. A fever is when your body temperature is too high. Fevers often accompany illnesses like common colds or the flu. Paracetamol helps to bring the body's temperature down. This can make you feel much better and more comfortable. It is especially helpful for children who are suffering with fevers. Reducing fever helps them to rest and recover more easily. It acts on the part of the brain that regulates heat. Doctors might also suggest paracetamol for other conditions. For instance, it can help with the pain of mild arthritis. It can also be used to relieve period pain in women. It's important to remember what paracetamol actually does. It treats the symptoms such as the pain or the fever. It does not cure the underlying illness causing these symptoms. Always seek medical advice for ongoing or serious health problems. Your doctor can diagnose the root cause and suggest appropriate treatment. Knowing the correct dosage for adults is crucial for safety. Typically, adults can take 1 or 2 500 milligram tablets. This dose can be repeated every 4 to 6 hours as needed. However, there is a strict maximum daily limit. Do not take more than 8 500 milligram tablets in a 24-hour period. This means no more than 4,000 milligrams of paracetamol per day. Exceeding this recommended dose can be very harmful to you. It can lead to serious and potentially irreversible liver damage. For children, the dosage of paracetamol is different. It usually depends on the child's specific age. More accurately, the dose is often based on their weight. Paracetamol for children frequently comes as a liquid syrup. Brands like Calpol provide specific dosing instructions on the package. Always use the measuring spoon or syringe that is provided with the medicine. Do not use a regular kitchen spoon for measurement as it's not accurate. Read the product label very carefully for correct guidance. Most people who take paracetamol correctly experience no side effects. It is generally a well-tolerated medicine by most individuals. However, like all medications, side effects are possible. These are usually rare and tend to be mild when they occur. Some individuals might experience a skin rash after taking it. An allergic reaction is also possible, though this is uncommon. If you notice any unusual reactions, stop taking the medicine. Consult your doctor if you are concerned about any reaction. Serious side effects from paracetamol are very rare indeed. They usually occur if someone takes far too much paracetamol. An overdose of this medicine is extremely dangerous. The most significant serious side effect is severe liver damage. This condition can be life-threatening if it is not treated properly. Signs of liver problems include yellowing of the skin or eyes, known as jaundice. You might also notice dark urine or severe persistent stomach pain. If these symptoms occur, you must seek medical help immediately. Certain individuals should be extra careful when using paracetamol. If you have existing liver problems, please consult your doctor first. This is very important before taking this or any new medicine. The same advice applies if you have kidney disease or impairment. People who consume large amounts of alcohol regularly also face higher risks. Alcohol can significantly increase the risk of liver damage from paracetamol. This is especially true when both are consumed close together. Always prioritize your safety and seek professional medical advice. Paracetamol can sometimes interact with other medications you might be taking. This means it can change how other drugs work in your body, or other drugs can change how paracetamol works for you. For example, some medicines used to treat epilepsy can interact with it. Warfarin, a common blood-thinning medication, is another such example. It is vital to inform your doctor or your local pharmacist. Tell them about all medicines you are currently taking. This includes prescription drugs, over-the-counter medicines, and any herbal supplements. What about taking paracetamol during pregnancy or while breastfeeding? Paracetamol is generally considered safe for use during pregnancy. It is often the recommended pain reliever for pregnant women. However, it is always best to use the lowest effective dose, and you should use it for the shortest possible time needed for relief. If you are breastfeeding your baby, paracetamol is also usually safe. Only small amounts are likely to pass into your breast milk. It is unlikely to cause any harm to your nursing baby. Always discuss with your doctor. In conclusion, paracetamol is a very useful and effective medicine. It is helpful for managing pain and fever when used correctly. Always read the product label and the patient information leaflet carefully. Follow the recommended dosage instructions precisely every time. Never, ever exceed the maximum stated dose for any reason. If your symptoms get worse or do not improve after a few days, see a healthcare provider. If you have any doubts or specific health concerns, please consult your doctor or pharmacist. Your well-being and health are of the utmost importance.